In this section, we'll be looking at diseases of the joints. Here we'll be looking at arthritis, which means the inflammation of a joint, and we'll look at three types of arthritis: rheumatoid arthritis, osteoarthritis, and gouty arthritis. First, let's look at rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease where the immune system mistakenly attacks its own body's tissues. Rheumatoid arthritis mainly affects the joints, but in some people the condition can also affect other organs such as the skin, eyes, lungs, heart, and blood vessels. It is much more common in females compared to males, and the usual onset starts in about young to middle age, which is around 30 to 60 years old. Women aged between 30 to 60 years old have a higher risk of developing rheumatoid arthritis. Those who have family history of rheumatoid arthritis also are at a higher risk. And smoking also increases the risk of developing rheumatoid arthritis. A patient with rheumatoid arthritis may have joint symptoms as well as systemic symptoms. For the joint symptoms, the joints are usually warm, swollen, and painful because of the inflammation. This often happens bilaterally, meaning both joints on the left and the right, and it most commonly occurs in the hands. So for example, someone with rheumatoid arthritis may have inflammation in both of the hands. People with rheumatoid arthritis also experience joint stiffness, which typically lasts for even more than 1 hour after waking up in the morning. The joint stiffness may also occur after prolonged inactivity. For example, if the person has been resting or taking an afternoon nap, they may also experience joint stiffness when they wake up. Besides joint symptoms, rheumatoid arthritis can also cause systemic symptoms such as fatigue, anorexia, which is low appetite, as well as low-grade fever. If rheumatoid arthritis is left untreated, it can even result in joint deformities, and you can see in this diagram some of the joint deformities in the hands. The exact cause of rheumatoid arthritis is unknown, but genetic and environmental factors contribute. We have seen that family history and cigarette smoking both contribute to the development of rheumatoid arthritis. In rheumatoid arthritis, autoantibodies such as rheumatoid factors are produced. The exact role of these autoantibodies is not very clear. We see that 80% of rheumatoid arthritis patients have these autoantibodies. But what about the other 20%? If they don't have these autoantibodies, then what is it that causes the inflammation? This is still not very clear. Let's take a look at the diagram, which shows a healthy joint versus a rheumatoid arthritis joint. In the healthy joint, you can see that where the bones meet, there is cartilage, which cushions the joints and absorbs any impact. There is also a synovial fluid in the space between the two bones, and this is covered by a synovial membrane. In rheumatoid arthritis, the immune system attacks the synovial membrane, so you can see that this synovial membrane becomes inflamed and thickened. This thickened synovial membrane is called the pannus. You can see that the pannus contracts and pulls the bones closer together. So this can cause joint deformities in rheumatoid arthritis. The pannus also erodes the surrounding tissue, and so it destroys the cartilage, the bone, the tendons, ligaments, and surrounding blood vessels. This is another diagram which shows you the difference between a healthy joint and a rheumatoid arthritis joint. Again, you can see that the synovium is thickened in the rheumatoid arthritis joint, and you can see that there are many immune cells, which are the white blood cells that cause inflammation in the synovium. There are several medications available to treat rheumatoid arthritis. DMARDs and biologic agents help to slow down the progression of rheumatoid arthritis. NSAIDs help to relieve pain and inflammation, and corticosteroids reduce inflammation as well. Besides medications, physical and occupational therapy can also help the patient to learn how to cope with their activities of daily living. And finally, if the joint is damaged beyond repair, surgery may be needed to replace the joint. The second type of arthritis that we'll look at is osteoarthritis. This is the most common form of arthritis, and we can also think of it as a disease that mainly affects the elderly. For osteoarthritis, it is caused by the degeneration of articular cartilage, which means the cartilage that covers the bones in a joint. This is usually due to wear and tear and/or trauma to the joint. Let's take a look at the risk factors for osteoarthritis. Old age is a risk factor because as we age, the cartilage becomes more susceptible to degeneration. Obesity is another risk factor because the heavy body weight would put a lot of pressure on the joints. Previous injury to the joint would also cause osteoarthritis. Certain occupations and job conditions which involve repetitive movements of the joints would also increase the risk, for example, farmers and laborers. And finally, family history also increases the risk of developing osteoarthritis. In osteoarthritis, the joint pain is usually unilateral, meaning it affects one joint on either side of the body. Of course, it could also be bilateral if both joints are equally damaged. In osteoarthritis, the pain occurs with movements, but it is better after rest. Joint stiffness can also develop after rest, but the morning joint stiffness usually lasts less than 30 minutes, which if you compare with rheumatoid arthritis, this is much shorter. In osteoarthritis, there may also be a reduced range of motion, meaning the joint may not be able to extend or bend as far, and crepitus, which means a grating or popping sound when the joints are being moved. Let's take a look at the diagram showing a difference between a normal versus an osteoarthritic knee. On the osteoarthritic knee, we can see that the articular cartilage has some wear and tear. We can also see some bony spurs, which are outgrowths on the bone. These bony spurs are actually caused by the bones rubbing together, which stimulates the bones to produce these outgrowths. And of course, this will further worsen the situation. Osteoarthritis is usually treated with medications such as oral or topical analgesics. This just helps to take away the pain. If this conservative treatment doesn't work, a patient can also consider injecting corticosteroids into the joint. Supplements such as glucosamine and chondroitin are also used, but unfortunately, the large-scale studies do not show that it is effective. If a person is obese, weight loss may also help because this will relieve the pressure on the joints. Physical and occupational therapy can also help the patient to learn how to cope with their activities of daily living. And finally, if the joint is damaged beyond repair, then surgery could be done to replace the joint with an artificial joint. Now let's pause for a while to see whether you can tell the difference between rheumatoid arthritis and osteoarthritis. For each statement, guess whether it describes rheumatoid arthritis or osteoarthritis. Number 1. Usually begins later in life. If your guess is osteoarthritis, you are absolutely right. Rheumatoid arthritis usually occurs in people who are aged 30 to 60 years old, whereas osteoarthritis usually affects the elderly. Number 2. Joints are swollen. If you guess rheumatoid arthritis, you are right. Rheumatoid arthritis causes inflammation of the joints, which will appear as swollen, warm, and painful joints. On the other hand, osteoarthritis will cause painful joints, but the joints are usually not warm and swollen. Number 3, affects small and large joints on both sides of the body. The keyword here is both sides of the body, so the answer is rheumatoid arthritis. Rheumatoid arthritis is usually bilateral, meaning it affects both the left and right sides of the body, whereas osteoarthritis is usually unilateral. Number 4, joint stiffness in the morning lasts for less than 30 minutes. The answer is osteoarthritis. Rheumatoid arthritis can cause joint stiffness in the morning for more than 1 hour, whereas for osteoarthritis, the duration is shorter, less than 30 minutes. Number 5, may have fatigue, anorexia, and low-grade fever. If you have said rheumatoid arthritis, you are absolutely correct. Rheumatoid arthritis can cause systemic symptoms like those that are mentioned here, whereas for osteoarthritis, it only affects the joints. Now let's take a look at the third type of arthritis, which is gout or gouty arthritis. Gout is caused by hyperuricemia, which means excessive uric acid in the blood. This could be due to underexcretion of uric acid in the urine, which is the most common cause, excessive production of uric acid, as well as overconsumption of food containing purines. And this is because purine is actually metabolized to form uric acid. That's why overconsumption of purines can lead to excessive uric acid in the blood. In gout, because there is such a high concentration of uric acid, some of the urate may precipitate as needle-like crystals in the joints. This deposition usually occurs in the peripheral areas of the body, for example, the big toe. And this is because the temperature at your toes are cooler compared to the other parts of the body. These crystals will initiate an inflammatory response, causing joint swelling and pain. With older age, there is an increase in the risk for gout. Males also have a higher risk compared to females. Diet also plays a part, so a diet that's rich in purines such as red organ meats and seafood would increase the risk of gout. Vegetables also contain purines, but somehow the purines from vegetables do not increase the risk for gout. Food containing high fructose corn syrup can also increase the risk for gout. Now, fructose is not a purine, but fructose is also metabolized to form uric acid. High alcohol intake is also a risk factor, especially beer, because beer has both alcohol as well as purines, so it is like a double risk factor. Obesity also increases the risk for gout, and certain medications, for example diuretics, which decrease uric acid secretion, can also increase the risk for gout. Although gout is usually associated with middle age or older age, we do see more and more young people getting gout nowadays. In this article, the title is quite interesting. Why more younger Singaporeans are getting gout? Too much beer and protein. Of course, this title is designed to attract attention, but it may not necessarily be very true. Okay, but with an interview with a doctor in Gleneagles, he says that certainly there are more patients in their 30s with gout. And one of the reasons that he proposes is that young people are consuming high protein diets, increasing their alcohol intake, but also lacking water intake. But another doctor also says that most of the time it is not the diet alone that has caused the gout. It is simply not true that the patient had gout because he was a meat or seafood lover. Most of the time, many other risk factors play a role. And these other factors would include hypertension, obesity, and a family history of gout. This condition also hits men more than women, but postmenopausal women are also more likely to develop it. So, how does gout look like? Gout usually comes in the form of gout attacks, where there is an abrupt onset of joint pain, heat, swelling, and redness in that joint. It typically affects the big toe, but sometimes it can also affect other joints such as the ankles, wrists, and knees. So initially, gout flares will often involve just a single joint, most commonly the big toe, and it will subside within a few days. But if it is left untreated, gout attacks can become more frequent, more severe, prolonged, and start to involve multiple joints. Chronic gout can cause joint damage and deformity. Sometimes tophi, which are nodules consisting of uric crystals, may also be observed. So in this photo, you can observe some nodules. These are actually made up of hardened deposits of uric acid inside. There are two types of medications to treat gout. The first type, NSAIDs, colchicine, and corticosteroids, are actually to treat the pain and inflammation when there is a gout attack. The second type of medications is to reduce the frequency of gout attacks. So these are things that typically decrease the uric acid levels in the body, and such medications are allopurinol, febuxostat, probenecid. There are also non-pharmacologic measures that can be taken to prevent future gout attacks. Dietary restrictions can help by avoiding or limiting alcohol, meat and seafood, as well as sweetened drinks. Weight reduction may also help, but at a slow rate. And adequate fluid intake can also help to flush out the uric acid from the body. Okay, now let's compare the differences between the three types of arthritis. So first of all, let's look at who has a higher chance of developing these three types of arthritis. For rheumatoid arthritis, women have a higher risk compared to men, and it usually starts in those who are aged 30 to 60 years old. For osteoarthritis, it usually affects men and women who are older. And for gout, it usually affects men, especially those who have risk factors such as obesity, high alcohol or dietary purine intake, as well as chronic renal insufficiency. Next, let's look at the underlying cause. Rheumatoid arthritis is caused by an autoimmune disease. Osteoarthritis is caused by wear and tear or degeneration of the articular cartilage. And gout is caused by excessive uric acid, which can then deposit in the joints. Now let's look at the type of joints that are affected by these three types of arthritis. As we said earlier, rheumatoid arthritis mostly affects the joints in the hands, but it can also affect the small joints in the feet, as well as larger joints such as the wrists, elbows, and knees. Osteoarthritis usually affects the weight-bearing joints, such as the hands, hips, and knees. These are the joints that we use every day, so there's a lot more chance of wear and tear to these joints. And finally, gout usually affects the big toe. That's all for this section. In this lecture, for the first part, we had covered diseases of the bones, which is osteoporosis, and in this second part, we have looked at diseases of the joints, which include rheumatoid arthritis, osteoarthritis, and gouty arthritis.